Welcome to Friday Framework. Today I'm going to share a framework that I really hope helps you get more and more results that you really desire. The framework that I'm going to share with you today is called the Iceberg Model. Now, just like an iceberg, you've got the bulk of the iceberg actually under the water so you can't see it. Now, we can see our results, but we actually sometimes aren't quite aware of what's causing those results, especially when the results are not exactly what we're wanting to achieve. So what I'm going to do is just take you through an exercise that you can apply to anything that's not going exactly as you wish it to go. And I'll talk you through an example as we go through this. So what we're going to do is we're going to start on the left side of the iceberg, and we're going to determine what our negative result is. So perhaps our negative result is that maybe we've got a low retention of patients. Maybe we're getting lots of new patients through the door, but we're not retaining them. So then if we look at our behavior, we can go and look at our behavior and think, oh, actually, if I look at this, I'm not actually recommending a full treatment plan to my patients. I'm saying to my patients, oh, go away and see how you feel. So perhaps you're not recommending exactly what is in their best interest. Then the next level down we need to investigate is how are we feeling? What is making us not recommend what our patient really needs? And perhaps we have a lack of confidence. So we don't feel confident. So we therefore don't actually we're not the expert in the room. We're just not confident. We're not feeling confident. And therefore we're not the expert in the room. And we're not recommending the treatment plan that the patient really does need to get the outcome that they are after. And then the next step down is we need to go down to what are our thoughts? What thoughts are driving how we are feeling and therefore how we're behaving? And so maybe one of the thoughts that you might have is, I'm not as good as other therapists. Now that we've got down to the bottom of the iceberg, we need to kind of challenge that thought. What that thought is limiting us. So that's a limiting belief. What would a more empowering belief be? The empowering belief is that you are the expert in the room, that you know what you've done. You've studied, you've trained, you're a qualified therapist. So you've really got to believe that you are the expert in the room. If you believed that you were the expert in the room, how would you be feeling? You definitely have improved confidence. If you had improved confidence, you'd be recommending a full treatment plan to your patient. You'd be recommending exactly what you believe they need to get the outcome that they want. So if your patient wants to get better and get back to running or get back to doing whatever they love, you would recommend exactly what they need to get there. And the result will be that your patient retention will be improved. So what I'd like you to do is just think about what are the results that you're not quite getting and they're just not exactly what you want, and use this model and let me know how it goes. I'd really love to know if you can use this model and if it does make an improvement. If you have any questions about the model, please do get in touch, and I will look forward to seeing you next week. Bye for now.